Hello, everyone. Welcome, and thank you for joining us on the South Sudanese Women Intellectuals Forum. My name is Dr. Anne Lomole, and I will be the moderator for this session. I'm a pediatrician and an infectious disease consultant. And today we will be discussing male and female infertility. And we're going to focus on medical, societal, and public health aspects. We know that infertility is caused by multiple factors and it can be attributed to both sexes. However, women suffer the brunt of the stigma and the societal pressure that's associated with it. Infertility, therefore, leads to greater societal and social impact beyond what medical issues are associated with it. Unfortunately, for most people, the services are inaccessible, either due to it not being available in either their region or their country, or due to it being very expensive. So today we are joined on the forum by Dr. Idioro and Dr. Victoria, who I'll be introducing in a few minutes. And we will be discussing the societal and public health and medical aspects of this topic. I would like to thank our panelists today for taking the time to share their experiences and their knowledge on this platform. And I would also like to thank the audience for joining in this live discussion that is streaming on YouTube and on Facebook. Please feel free to share the link on your Facebook walls for others to follow. And do not hesitate to ask any questions on our wall. For the questions that we're able to answer, we'll try and answer as many as we can. But if not, then our panelists will come back later and answer them on the page. We'd also like to thank our donors. We'd like to thank our members for their continuous support. And we'd also like to appreciate Aisha, who's currently behind the scenes on technical support. So I'll go straight to introducing our panelists, and I will start with Dr. Idioro Ojukwu, who is a practicing obstetrician and gynecologist at the Mater Hospital in Nairobi, Kenya. She did her bachelor's degree in medicine and surgery in the University of Juba and her master of medicine and obstetrics and gynecology in the University of Nairobi. She is a fellow of the East Central and Southern Africa Obstetrician and Gynecologist Society and the first gynecological oncologist in South Sudan. She recently won the FIGO Women Awards. FIGO stands for the International Federation of Gynecology and Obstetrics, where she was recognized for her exemplary work in her field. Next, I'd like to introduce Dr. Victoria Anib Majur, who is the current head of the Social Development Unit in the Health and Social Development Division at the IGAD Secretariat. She is the former Undersecretary for the National Ministry of Health in South Sudan and has served at the Ministry of Health in various capacities as a Minister of Health in the state and also as a Director for HIV/AIDS, STI Department and Blood Transfusion Services in the National Ministry of Health. Prior to this, she worked in Australia, and she was a member of the Australia Society for HIV Medicine and a member of the Technical Advisory Committee for the African Society for Care of Children Living with HIV. And I'd like to welcome you both to this panel today. Dr. Idioro, it's nice to see you again. And Dr. Victoria, it's nice to have you on the panel after quite a while. Thank you so much for joining us. Now, I will go straight ahead to the questions. We'll start with Dr. Idioro. We've lost Dr. Victoria for a bit there, but it's okay. We'll just go straight on into the discussion because Dr. Idioro will be focusing on the myths and trying to explain in as easy terms as possible everything about infertility from the medical aspects. So, Dr. Idioro, for those of us who are listening in and they don't know, what is infertility? And what is the prevalence of infertility when we think about men versus women? Why is there a difference in that prevalence? And do you have any figures for South Sudan in comparison to the world or general figures worldwide?
Okay, thank you, Anne, for having me. And thank you all to our audience who have joined us this evening after a long while. I will say infertility is a complex disorder which has actually significant medical, psychosocial, and economic aspects of it. And just allow me to put a disclaimer that whatever I will be discussing here will not be deliberately referring to any of my clients or their situations. Whatever I will be saying is just a general reference to a common happening in our society. I will define infertility is defined as like we have a couple who are trying to achieve pregnancy, but they are unable to, despite not using any form of family planning for a whole 1 year. I think this is in simple terms. So people have to stay for at least 1 year before they start seeking services for infertility. And going to some figures, I don't have local data for South Sudan. I think this is also, most of our people even don't come forward. So maybe it will take time for us to get our local accurate data concerning infertility. But at least 20% of cases have been shown to be attributed to men, while 38% has been shown to be related to female factors. So, and to both male and female is around 15%. This is according to WHO. So I think this is where I can just briefly say for now.
So is there a possible reason for why about 38% is attributed to women, and I think you said 15 to 20% that's attributed to male? Is there a possible explanation for that?
I can't say there is a possible explanation to it, but I think most of the factors are actually female related, because when we come to now the factors related to infertility in females, they are much more than the ones for male. Yeah.
Okay, thank you for that, Dr. Idioro. We'll just slightly go to Dr. Victoria before we delve into the nitty-gritty of the causes and of infertility in both males and females. Dr. Victoria, you worked with the Ministry of Health in South Sudan for quite a long time in various capacities. I'd like to know if you are aware whether there is any strategy in South Sudan for or some kind of action plan on infertility and what it entails. Is there any kind of document like that or any kind of strategy in our country? Sorry, Dr. Victoria, you're on mute.
Thank you, Anne, for this opportunity for the second time to be on this platform. As of my last update, there is no any specific strategy as a standalone to deal with infertility. However, there is a national action plan for reproductive health services where infertility is mentioned, but it's not as a standalone. And I do know that it's very important for the government to prioritize infertility as a public health issue and to develop a comprehensive strategy to address it. So I think it is something that we need to advocate for as healthcare workers, health professionals, especially people like Dior and other specialists working in the field of obstetric gynecology. It's very, very important for us to have a standalone strategy that detailed infertility and take it as a priority. But as of now, there is no standalone strategy or national action plan, but it is mentioned in the National Action Plan for Reproductive Health Services.
Thank you so much for that, Dr. Victoria. I think down the line, we'll talk about some of the actions and policies that can be instituted to ensure that infertility is not something that is left by the wayside as we focus on other things when it comes to reproductive health. Now, my next question for you, Dr. Victoria, is from your practice and experience, or for the experience of others that you have been around, what are some of the myths that are associated with infertility, if any, and what are some of the reasons behind those myths?
Oh, I think there's a number of myths associated with infertility. And that causes a lot of the psychological impact that Dr. Dioro mentioned earlier. In our society in particular, whenever there is a case of infertility among couples, they always tend to think that it's the woman's fault. So it's always blamed on the woman. So this is the first myth and the most difficult one to deal with. There is a lot of stigma associated with that, and people always think that it is to do with the woman. The other myth is that they think that if you have a child, the first child, you will not have, you'll no longer have infertility, not knowing that there is secondary infertility. And perhaps Dr. Dioro will touch on that later. So secondary infertility does exist, and women can have a child and later on stop having more kids for any other reasons. So that's another myth. The other myth is age. 40 and more can see sperm count decrease in males, but people always tend to say that females are the one who, when they age, they no longer have kids, but men, regardless of their age, will still have kids. So that's another myth as well. Another myth is it's all infertility issues are related to change in lifestyle. While maintaining a healthy lifestyle can help you improve your fertility, it doesn't mean that it will help you to, like people say that you are obese, you have to reduce your weight to get pregnant, which is sometimes not scientific. And there are other reasons, hormonal and other reasons that can help people, not that can prevent you from having to conceive. Yeah. Other myth is genetic. People always think that it is due to genetic reasons that you don't have to get to conceive, but it's not always genetic reasons that prevent women from conceiving. The last myth I will talk about is the fact that people link infertility to curse. They say that this lady is cursed. Maybe it's a generational curse from the parents or from the great grandparents. That's why she cannot conceive. But it's also not in place, and it's not correct. So these are a few of the myths and misconceptions people have. They also link infertility to use of contraceptive pills, saying that if you use contraceptive pills for a long time, you will not be able to conceive. But I think Dr. Dioro will also might have touched on that. Some people do use contraceptive pills, and they go off the pill for a while, and they get back to normal, and they can conceive. So these are a few of the myths and misconceptions around infertility that are very common in our society. And our society stigmatizes women greatly, significantly, and that causes a lot of psychological trauma and stress on women in particular.
Thank you so much for that, Dr. Victoria. I think you've mentioned quite a number of myths that are associated with infertility. And we'd like Dr. Idioro to debunk some of those myths for us by actually giving us the scientific details and causes and reasons behind infertility. So, Dr. Idioro, if you could please expound on female infertility, talk about the types and the causes, and also expound on male infertility and talk about the types and the causes. And maybe tell us after that discussion why most men end up not being tested as compared to women. What are some of the causes of male and female infertility? And if you can just give us a slight explanation on why men might not be tested as much as women when it comes to that.
Okay. Sorry. I think infertility is actually a wide topic, so I will try as much as possible to summarize what our audience will be able to understand. I think maybe I just add to what Victoria has said concerning the myths that surround infertility. One of it, as she has mentioned, is people think it's a curse. So like the couple is being taken through a lot of rituals, which take so many years. And, as you are wasting time, also things and age is catching up. So the, people actually end up like just going from village to village. Rituals are conducting, cows are paid to cleansing are done. But actually, at the end of the day, people should just seek medical attention. Like I've defined, after 1 year of failure to achieve conception, people should just seek medical advice. Concerning female infertility, like I've said, we have a primary and secondary types. So when we say it is a primary infertility, that means it's a lady who has never conceived, not even had miscarriage. So she has never achieved conception in her life. That one is primary infertility. Now, when we come to secondary infertility, we define it as someone who has kids before, then stop conceiving or achieving conception. So this one is secondary infertility. So the factors which are involved with female infertility include fast ovulatory disorders. And this one, it actually takes 25% of the causes, but that is generally. I will still come to us specifically, it's also different. And we have endometriosis, which is also associated with female infertility because it causes also pelvic adhesions and tubal blockage. Tubal blockage is one of the commonest factors that we have in South Sudan, and this is related to infections. So I think for us, if I'm to rearrange it, our tubal factors come first in our South Sudan setting in terms of female infertility. Then again, we have hyperprolactinemia, which is also associated with female infertility. Hyperprolactinemia is like one of the hormones which is secreted from the brain is just too high, secreted from the pituitary gland. So that this causes actually imbalance in ovulation and so on. So again, like Victoria has said, also age in female has a contribution. Like we said, after the age of 35, usually fertility decreases. And again, as we go to say these causes, we also have to put in mind that sexual intercourse is actually very important. And then sometimes people have the coital frequency. So that one also is another factor for infertility. So like I said, tubal factor, the primary cause is actually because of pelvic inflammatory disease. When we come to, and Victoria actually genetic factors also, we have inherited thrombophilias, autoimmune diseases also are contributory factors, but though they are very minimal, but also they are there. And now when we come to male infertility, also there are causes which include aging, like Victoria has said, after the age of 40, that is what us actually in our setting, people think men can actually give birth until they die, and not forgetting that actually the sperm count also reduces with age. And the most of the causes for male infertility actually is around the sperm. So like the sperm count matters. So anything that affects the production of the sperm actually affects male fertility. And also there are environmental factors. Like in our setting, I can say, because actually people are not utilizing the immunization well in South Sudan. And I think I've not worked in a clinical setting in South Sudan, but mumps is one of the viral infection which happens, and we get viral attack of the mumps virus on the testicles. And this one in future also again reduces the production of sperms. Again, we have radiation and some drugs. And in our setting, people also forget that smoking actually reduces the quality of the sperm, and alcohol consumption. And also there is hypothermia, so which is not well studied, but actually also attributed to male infertility. And now coming to a question, why we always investigate females more than males, because actually for male, it's only that one test we check for the sperm count. So if there is a low sperm count or abnormality in the sperm, Then we send them to urologists to do further investigations and see whether they are the tubes that bring the sperms from the testis or the testis itself has an issue. So like when they come for the investigations, only we start for males, we only do the semen analysis. Then for females, we work with the rest. But because for men, once we get the sperms are low, then that is when we send them actually for further investigations. And the investigations for men are actually more costly than for women, because again, also we have to check for chromosomal abnormalities and so on. So that is why when a couple comes for infertility checkup, we need to start with the men and start with the seminalisis. Not unless the men say they have sired a child within the last 3 months. But again, we can't confirm. So I think these are some of the issues that we concerning both female and male infertility.
Okay. So this question is basically from like your personal experience and practice. Have you seen a lot of the males or the male partners actually coming for fertility testing when they're seeking advice on infertility? Is it common for the men to come along, or this is not something that's very common?
Yeah, in the setting where I am, mostly we find the men actually they come, but some, as usual, they will not come. Yeah. So it is a common thing that men actually come forward for the test. It is an issue.
Thank you,
Yeah.
Dr. Ijura. I hope with this discussion we will have done enough education to ensure that the males also come along for the investigations, because as we've heard from Dr. Iduro, that there might be an issue also with the sperm count, and sometimes they even say there might be issues with how the sperms look like, what we call morphology, and this might contribute to male infertility. So it's important for the men to come along with the women when they're seeking advice or medical intervention on infertility, so that we ensure that the issue that is causing infertility is actually picked up, whether it's in the man and the woman, and then a way forward is plotted. Dr. Victoria, we'll go back to you. Some of the myths that you've talked about indicate that most of the stigma actually is towards women generally. So, what is some of the social impact of infertility, and what cultural or societal factors have led to women being targets of stigma when it comes to infertility, from your experience?
Well, from my experience, we come from a culture that embraces having so many kids, and they see that having children is having an extended family or a big family is like pride. And most of the functions, there'll be family gatherings, and sometimes women who have infertility issues are like you can hear people making comments, or sometimes they live in isolation, and that causes a lot of psychological distress for these kind of women. And they feel they are not treated equally, even when it comes to the family opportunities, and even sharing of the wealth, or perhaps if God forbid the head of the family pass on and a woman doesn't have kids, she doesn't get treated the same way the other women who have children are treated. So that causes a lot of psychological distress to the women, and they live in isolation, and they live in a lot of psychological trauma. Our culture doesn't favor women who are infertile, who don't have kids. And this calls for us to do a lot of work in terms of awareness raising, and in terms of breaking those myths and misconceptions about infertility, because it is not a mistake not to have a child. Being barren, even in the Bible, we have stories about women who have been barren for and it is there from long time back in history. So I think the treatment that women who are infertile receive is not like the treatment that other women receive, and society is always mean unto women. And some cultures, for instance, where I come from, a female who doesn't have kids is subjected to have her brother-in-law or any other relative to impregnate her and have the children. And sometimes it is contained within the family to the point that the woman has to bear the consequences. She has to bear having a father of the child as well as a husband, and not a very easy situation. I don't think any woman would like to be in that kind of situation. It's unfair for women. So we are subjected at times to unfair treatment because of the culture and because of the society, and I think this needs to stop. So these are a few of the things I would share with our audience today regarding the culture and how culture perceives women, and how even if the man is infertile, the woman still have to pay the price of it and bear the consequences of the infertility of her partner, just to keep the image of the family, and perhaps just to, for the pride of the husband. So that happens in many of the cultures around us.
Thank you, Dr. Victoria, for that. I think you expounded a little bit on what cultural issues we face as women. On the other part of it, what are some of the effects that gender roles have on fertility, and has this changed over time? And what impact does gender equality and inequality have on fertility?
Well, gender roles in our societies from long time back, it's expected that a female has to have kids and stay home to do the household chores, and that also restrict women participation in decision making and in developmental activities of the society, and that has restricted women over the years. However, I feel that this has changed. It has changed over the years. Now people are more aware about different gender roles. With the education and increased literacy, things have changed. People are now appreciating education of female and the girl child education. We people are now tending to work to stop early marriages and forced marriages. So there's been a shift in the thinking of our people and the mindset of our people, although not to the level we want, but at least we need to appreciate that our people have changed. Society is also changing, and with globalization and with advent of technology and education, the mindset of our people is changing. The gender roles is having issues on fertility because you are expected as a female to have as many kids as possible, not minding of your autonomy, not minding of how many kids you want, not minding of the spacing you want for your children. But in other parts of the world where people are more educated, more enlightened, women have the autonomy to decide on the number of kids they have, the spacing they want, and when or where to have their kids. For instance, I know some females, Dr. Idioro, they prefer to have a cesarean section than to have a normal delivery. It's their choice. It's the type of autonomy they have reached in their countries and their societies. But our society is still backwards. It's still the culture is impacting on us. But I will say that there's been a shift and a change from before to now. There's a lot of change that we need to appreciate, and we need to build on that one and take it as an opportunity for more progress in the thinking of our people.
Thank you so much, Dr. Idiro. Quite a number of positive comments there about how things are changing, at least for us in our country. And we know that there's a lot of inequality when it comes to the power women have to make autonomous decisions. And this might also affect them seeking care if they need to, or seeking some of these services that might be available for either fertility or infertility, or even reproductive health in general. And the lack of literacy and ignorance and the lack of exposure can also lead to them not being able to know that they have a right to actually go out there and look for a solution for their reproductive health issues. So thank you for that, and thank you for the positive comment. We tend to have a lot of negativity associated with what's going on within our communities, but it's very good to hear you say that you have actually noticed a trend towards change among our people. So, Dr. Idero, we'll come back to you now. You mentioned that tubal factors, which basically means that the fallopian tube, which connects the ovary to the uterus, might contribute as one of the most prominent causes of infertility. And what I wanted to hear from you is, we know that sexually transmitted infections are quite common, and some of them actually lead to this tubal blockage you're talking about. Which of these sexually transmitted infections can lead to infertility, and how do they lead to infertility? And what would be important if someone would want diagnosis done and treatment done? What would need to happen, and why is treatment and prevention important when it comes to STIs in general?
Okay, maybe I will start by just putting more weight to what Dr. Victoria has just said. Our society actually is just a patriarchal society, and they see men like actually the best. So when there is infertility, now that one should not be the issue. That one is usually perfect. So they always go to the weaker side who doesn't have any option. I think that is where actually we are coming from, and usually the woman is the one who is pushed forward. Then again, like in my practice, so sometimes I just find myself I'm just too hard because I want to give women that autonomy. So when the decision for CS comes and they're saying, ask my husband, I ask them, how old are you? Above 18, you're supposed to consent for yourself. And even I call the husband, she's above 18, she has to consent and take the decision herself. That is all because I want to build also that woman's capacity. Let us all women know that we have responsibility to our own health and our own lives. Then again, concerning education, yes, maybe some people still don't value girls' education. But again, in my practice, when I find a young girl and I always ask if she's already married, how old are you? What level of education have you reached? Then when they tell me, I said, okay, as you are giving birth, make sure you also continue with your education. As long as if the person you are with is supportive, you better continue with your education as well. So I think the responsibility should be upon all of us to support also these girls and young women, that education is important so that they get their own autonomy. In terms of the common STIs that we have, commonly we have gonorrhea. Gonorrhea is more common actually, and pelvic infection is one of the common things that I found in during my practice in South Sudan, because even a young girl will just come and say, I have. So like it's just something which is simple, but they don't take it the weight that it comes with it. Why are you having that iltihab? So I think the most common infections which are associated with tubal blockage is gonorrhea. It ranks number one, then chlamydia infection. Then also we have the mixed infection. And this is because these infections, they result in generalized pelvic infection. And that one blocks the tubes. Yeah.
Thank you for that, Dr. Idioro. Are there any preventative ways you can mention to ensure that people don't get these STIs? Maybe we should just mention a few so that they're aware. I know we take this for granted that people know what they're supposed to do to prevent these infections. Just mention a few, and then we can move on to the next question.
Yes, I think to prevent this infection, I think we need to limit sexual partners, because if you have multiple sexual partners and the others have multiple, we will end up not knowing where the infection is coming from. And secondly, use of barrier method of contraception like the condom. These ones actually are very much protective against these sexually transmitted infections, and including HIV/AIDS. So, but I've had recently young people are saying they are not afraid of HIV, but they are rather afraid of pregnancy. But I will still say we better be fearful of STIs than even the pregnancy itself. Yeah.
That's quite true, and it's very concerning, this lack of fear for getting HIV infection, because it's something I'm also seeing in my practice, that people say, oh, this is just like hypertension and diabetes. I mean, you drink your medicine every single day until the day you die, but there are attendant issues that come with it, including issues with fertility, including issues with what they call the opportunistic infections. And this is something that actually affects your immunity and takes it all the way down. So it's not something to joke about, or to look at as not being dangerous. And it's very concerning that within our society now there is no fear, despite the fact that HIV now still does not have either a cure or a vaccine. So this is something that we need to do a lot of advocacy about. Dr. Victoria, if we can go back to you, um, what are some of the preventative actions and policies that can be instituted at a public health level to prevent infertility or manage its societal and individual effects? Are there certain policies that can be instituted at the public health level? Dr. Victoria.
I think it's important to do awareness raising. People need to be aware of infertility, like what Dr. Diora has just done now, because many people don't understand infertility and effects of infertility. They have to understand the gender roles, implications on infertility. So awareness raising campaigns are important. Supporting mental health part of it is important, because there is a lot of psychological sequelae for women who are infertile. They get traumatized, they get distressed, stress from the family, stress from the community, and they need the psychological support. It's important to have that in place. Also, there's important for workplace policies that need to be implemented. For instance, people who have issues of infertility often have to travel for medical checkup, especially in places like South Sudan, where there is limitation of access to infertility services. They have to travel to Nairobi, they have to travel to India. So there is workplace policies are important to support these kind of individuals. Also, addressing environmental factors, like Dr. Ejure mentioned earlier, there is environmental factors that can affect infertility. So there is a need to work on that. She has also mentioned the lack of data, and lack of data cuts across the board, Dr. Ann, and that's a serious challenge for us in the health sector. Evidence-based programming, evidence-based policies, direction are nowadays the trend, and it's very important for us to conduct research and collect data on public health agencies that can promote, research on infertility, the causes, the treatment options, for people to understand better and to contribute to the development of effective preventive strategies. Research is quite important and paramount. Also, there are things like fertility preservation. I know it doesn't exist in South Sudan, but it is something people, if some South Sudanese women do it, freezing of eggs, freezing of sperms for future, if you want to, especially for those who have medical conditions that doesn't allow them to have kids at the moment, they can opt for that options. So I think these are a few of the policies that, if implemented, can support public health efforts to help prevent infertility and support individuals also who want to tackle their fertility issues.
Thank you for that, Dr. Victoria. I think I like the fact that you emphasized on the importance of data and research into infertility and other issues basically in our country, because it's difficult to justify allocation of resources, whether it's human resource or financial resource, towards a particular issue if you cannot justify it by numbers. So thank you for emphasizing on that. Now, Dr. Idioro, how is infertility let's focus on women now, because I think you mentioned that the men, it's more about just looking at the sperm count and looking at the type of sperms that you're producing. And if you're going beyond a certain level, depending on what you're suspecting, also looking at what we call karyotyping. Specifically in women, how is infertility diagnosed? What are some of the tests that are done? What do they look for? And what are some of the challenges that are faced when it comes to diagnosing infertility in women?
Okay, I think before I go to the investigations, maybe I will just add one thing. In our setting, tuberculosis is still common, and tuberculosis also is associated with infertility, both in male and female. So I think this is also one thing that we need to take seriously. So when we come to investigations for female fertility, we have first to confirm that ovulation is happening. So it's happening normally. So because sometimes women is with irregular menses, also sometimes we get that most of the time they are not ovulating. Then I think this is the first thing we have to confirm, that woman is ovulating before embarking onto the other investigations. And most of this can actually be confirmed just clinically: signs, dysmenorrhea, regular cycles. So these are some of the things that we will be able, or now documentation of the ovulation time by taking the temperatures. Then after that, we do a test to exclude that there is any tubal blockage, the fallopian tube. And now commonly we do the HSG, which is an X-ray done on 10th day of the menses. So the dye is pushed through the vagina, then an X-ray is taken to confirm whether the tubes are actually blocked or not. Or we can actually also do that laparoscopically. And at the same time, when it is diagnosed that the tubes are blocked during laparoscopy, because it will also be a treatment at the same time, then the tubes can also be unblocked at the same time. Then also there is a test we check for the hormones which are actually involved in ovulation, the FSH, LH, and the estrogens level. Then again, we check for the, we do a test called to check the anti-Mullerian hormone. This one will give us whether this woman is actually still having enough ovarian reserve for fertility. And mostly this happens for most of the women above 40 years old. Yeah. I think these are the investigations that we do for women. And as for men, I said earlier, is only we start with the seminalysis. Then after the seminalysis is when we just go further now to check whether there is chromosomal abnormalities, whether there is obstructions of the tubes bringing the sperms from the testes. Yeah.
Thank you, Dr. Idira. That's quite a comprehensive overview of some of the tests that are done. I think that really helps quite a number of people who are watching here right now, so that in case they seek intervention, they know what exactly is going to be done, and they know the scope of the testing that will need to happen for the doctor or the medical person to determine what is going on. Now, if you can just go a little bit into how now infertility, once you determine what the cause is, depending on what the causes are, how is infertility then managed in women, and in terms of treatment and follow-up, and is there any stigma that is associated with some of these fertility treatments, and why? Dr. Idira, you're on mute.
Yeah. I've unmuted. Yes. Again, as I said earlier, we manage it according to the cause. If it is like these hormonal imbalances, we do induction of ovulation. Then if it is tubal factors, we can also try and blocking it, although the success rate is not as high as when the tube is already patterned, but also we give this one a try. And we encourage women to go for IVF. Yes, as you have said, IVF is associated with a lot of stigma, but I think now people are aware that it's actually a solution, and you have to seek it as early as possible, not listening to people saying, no, it is a curse, and people are taking in cycles, going here from one village to another, seeking solution to, to fertility. So IVF, the only thing is because it is very expensive, then that is actually one of the hindering factors where most of the people can access IVF facilities. And I can just give an example where people actually have admits that children of IVF children don't survive for long, they die early. So you are not a woman, you are not woman enough. Why is a baby being implanted? So I think these are some of the things which actually cause psychological disturbance in infertile couple. And even some men will go further and say, I will not go and give a sperm for IVF, that will be over my dead body. It's actually a whole lot of psychosocial issue, but I will just advise people that it is actually a solution. Like you get malaria, you go to the hospital and you are given treatment. So it is actually a treatment. And the treatment, the goal of the treatment is to achieve, to get a baby or a child or children. Yeah, even some people after having one IVF, they subsequently get just pregnant naturally. So I think I will just advise people to the issues surrounding.
Okay. Dr.
Sorry,
Idioro. Sorry, yes.
yes, I was just saying, I just encourage people to demystify IVF. Children with IVF are just the same like any other child. If you put them together, there no one will go and pick that. No, this one was an IVF, because some people actually they just get worried and say now these children, people are going to point on them and say this one was planted, blah blah blah. So I think let's just consider IVF as a treatment. Yeah, thank you.
Just in simple terms, Dr. Idioro, just explain in very simple terms what IVF is, so that the individual sitting at home who does not have any medical exposure like me can understand.
Yeah.
And also, yes, just so in
Yes.
simple terms, yeah.
Yeah. IVF, the full name is in vitro fertilization. That means the egg from the woman and then the sperm from the man. Fertilization happens outside. They are brought together outside, not inside the body. Then after fertilization happens, then it is taken back and put into the woman's womb. Yeah, then the baby grows there.
Dr. Idioro, is there an age limit for IVF, or does it depend on whether there's an egg and a sperm? Is there any particular age limit where IVF can and cannot be done?
I will not be able to give that one as an accurate answer, because we also have our fertility specialists and I'm not one of them. But what I usually hear, age less than 50, most of the people will not do IVF for more than 50 years old, not because they will not be able to carry the pregnancy, but because of the complications that come along with pregnancy and age-related issues. Yeah.
Thank you for that, Dr. Idioro. Are there any consequences or effects of some of these treatments that are used for infertility, and how are these prevented or managed? Are there any side effects that you can mention?
Yes, there are many side effects. The common one, we can have ovarian hyperstimulation syndrome, and sometimes it can be severe. Yes, it can be severe, even it can lead to renal failure, but these are some of the complications which are, I can say, not very common. And then using the drugs also, again, some of the women can get along with hypertension in pregnancy. They can develop what is called preeclampsia. Yeah, and this one is also associated with mostly with the age of the women. And then again, IVF is associated with multiple pregnancies. Most of the time, they end up carrying twins. And multiple pregnancy actually comes with some of these complications as hypertension or gestational diabetes. Yeah.
Thank you, Dr.
And
Iduri.
again,
Yeah.
maybe I will just add this induction of ovulation in IVF. It is said that one cycle actually stabilizes the ovarian reserve like for the next 2 years. So again, these are some of the complications that comes along with IVF. So induction of ovulation happens, so multiple eggs are recruited. Yeah.
Thank you for that. That's very educational. So it's quite important for individuals who are seeking these services. When you're in front of the medical professional, you ask these questions. You ask about side effects. You ask about what exactly is going to be done, and you ask about what the process will be as you go through some of these interventions. Dr. Victoria, Dr. Idiro has talked a bit about some of the interventions for infertility. What are some of the challenges when it comes to accessing these fertility services? Are there any that are specific to South Sudan or Africa in general? And do we have services in South Sudan for managing infertility? If not, what can we do to improve access to these services?
I think one of the biggest challenge in Africa, and in particular South Sudan, is access to the service itself. In South Sudan, there is no fertility center with the required infrastructure and equipments that can support women with fertility issues. I was chatting with a friend, a colleague, an ecologist, to inquire because I've seen IVF center opposite Queen's Medical Center sometimes back, owned by a prominent gynecologist from Sudan. And unfortunately, their aim was only to investigate, do the preliminary investigations and diagnosis and some of the things before going to Khartoum to do the actual IVF or the different procedures. But then when Sudan war broke, that center has not been doing that anymore. So as we speak now, there is not a single fertility center in South Sudan that can assist women with fertility issues to go and have. So it puts a lot of financial burden, and that's one of the challenges. The financial implications on families. Many couples will travel to Nairobi. Some of them will go to India, some will go to Egypt. Previously, they used to go to Sudan. So the financial burden, and as mentioned earlier by Dr. Dioro, the cost of IVF is very expensive. It's very expensive. The investigations are expensive. The procedure itself is expensive. Having to stay in a foreign country for almost 8 weeks before you realize the conception and do the test to confirm it is also a challenge. You have to perhaps rent a place to stay because it's not in your home country. So that these are all putting a lot of burden on couples. So the financial part of it is really a challenge. The stigma around it is another challenge. Many people who go for IVF tend to hide that they are going for IVF. There is a lot of secrecy around the infertility and the fertility treatment itself. People tend to hide; they don't want to share the information. I know it's a private; they have the right to for their privacy, but it's all because of the stigma. So these are a few of the things that are main challenges facing the issues of infertility in South Sudan. So limitation of access to the services itself, the stigma around it, and the financial burden that comes with the fertility treatment. These are a few of the things I could mention.
Thank you, Dr. Victoria. Of course, the hope is that as we progress with the years and as we train more health professionals, especially in reproductive health, we will get the human resources at least to start up these services in the country and eventually be able to go through the whole process from investigation to actually the implantation and and continue these services for women who are unable to have children, or for couples who are unable to have children. And maybe that might assist with the financial burden going down. But I have to say that even in countries where these services are available, many people cannot actually afford the services because of the expense. So we hope that with time in future, the cost will start going down. Dr. Victoria, is adoption or surrogacy, if you can just define either for both of them for us, is it an option that's actually considered among our people? And what are some of the legal and ethical issues that are associated with adoption, surrogacy, and IVF or fertility treatments? And are there any that relate to South Sudan? And are these
I
services even
think
available?
I think
Is it possible?
adoption is an option in South Sudan, and since one Sudan, many women have been adopting children, and even now in South Sudan, it's still the practice. People are adopting kids or taking somebody else's child or taking a child from the orphanage to be your own. And I think the only challenge is that there is no legal framework yet to support adoption. I spoke with one of the legal practitioners, and currently there's no laws, standalone laws that are supporting adoptions and surrogacy. And however, people are still adopting, and it's important to understand the legal implications. And because sometimes the dispute can arise in future, so it's important to seek legal opinion from legal experts to support you, come with the documentation, and also to sit with the two parties so that each one understands the implications and each one understands that this is a legal thing that's being done, and have proper documentations, because as of recent, women have been adopting children and taking them overseas to diaspora, those who have issues of infertility. And overseas, you need to have the documentation and proper documented legal documents from a legal practitioner and from the court that this child has been adopted. So it's still, there is although it's being practiced by a few, the concept is not yet fully understood in our context, and that needs a lot of awareness from our legal people and from us health professionals as well, because it's a multidisciplinary thing, and we all need to work together to make our people more aware of this surrogacy and adoption. I know we are a country we have limited resources. Economic pressures are too much. Vulnerable families can get exploited when it comes to adoption, and that's why there is the importance of the of both sides and people and families to understand their legal rights and to understand how to go about that. Also, orphanages need to be in picture, and they need to understand how the legal implications and how to organize it in a legal manner. And I think also the role of Ministry of Gender, Child and Social Welfare comes in here. And I was told that for you to get an adoption, you have to go to the ministry to get some documents. So there is a lot of work that need to be done, involving Ministry of Gender, Child and Social Welfare, and our legal people, and other, line ministries involved in this, so that we do the right thing. But I would say that surrogacy is not yet prominent in this country, though it's being practiced at individual level in other countries. Or they go to other countries to get, for instance, to have surrogate children. But adoption is there. It's being practiced at a low scale, and it needs to be done properly, and people need to invest in more and do better in that field.
Thank you for that, Dr. Victoria. I think we also will probably then need to weigh in on advice from our legal experts on what can be done to actually lay down the legal framework for that, so that the correct papers and the correct rules are followed when it comes to adoption. Dr. Idora, do you have any comment on that, adoption or surrogacy?
Yes, I think I'll just add a few. The legal framework is actually the number one most important thing that should happen. At least we start with the adoption. But then when it comes to, I think what the adoption that is happening currently in South Sudan is just like a local arrangement. Then again, our communities, they are so used to where once this woman is not giving birth, you are pushed for another child from the relatives that help this one to be yours. You know, you are giving me a child who already knows the parents, and the name for that child is still the parents' name. So this is not adoption. Yeah, so I think we really need to work on that legal framework to support adoption. Yes, and then again, like Dr. Victoria has said, orphanages, I think also they need to understand and they need also to work on how they can help the children who are there and help them find uh, families that can embrace them. Yeah, I think that is, and maybe at the end of it all, I will also add that families need to support infertile couple by just giving them an opportunity to go for the IVF, help them financially, and accept the children which are brought out of IVF. There is no need of pointing this one was an IVF and this one was natural. Let's just embrace all the kids together. Yeah, I think this is one of the support that I will just request from families and communities. Yeah.
Thank you for that, Dr. Iduri. You can just expound more on the community support, because I know stigma is one of the biggest issues, and that's why even when people go for fertility treatments, they do it in secrecy, the way Dr. Victoria has indicated. So, what are the broad things we can do, both as individuals, as families, and as communities, to support those who are affected by infertility?
Yes, I think at individual level, let's as we are discussing now, I think at individual level, as this group are saying, we are in support of IVF. And then at the community level, our community should know that IVF is a treatment for those who are not able to conceive naturally. Just the same like someone who is not able to give birth naturally and being delivered by CS, still that one has a stigma. But I think we should just tell our community that this is something which is happening. It started happening in the Western world since 1978, and the first child of IVF is already a grandfather or something. Yes, so they should know that this thing is just the same like any other treatment. Yeah.
Thank you so much.
And again, the infertile couple, they should just come up and open it up instead of being in so much secrecy. That is when actually people start looking for it. But now, if you tell anyone, no, me, I was not able to, and I could not wait, and I'm doing IVF, I don't think people will not even talk about it. Yeah.
So in general, just creating awareness and getting rid of stigma, and even those who have gone through the process, just talking about it so that other people have more courage to actually look for this solution. I think it's very important what you have said, especially about individuals who have actually gone through the process, because they at least have obvious evidence of the fact that this works and this is a possible solution. And since they have the courage to do it, then they will also give other people courage to look for those interventions. Dr. Victoria, we know that infertility, because of the stigma also and the isolation and the fact that many of these things are being done the interventions are being looked for in secrecy, we know that it can lead to mental health issues. What are some of the interventions at individual and societal levels that can minimize the mental health impact of infertility and fertility issues?
Like you said, it's one of the really complications of infertility, the psychological burden of it. It's not easy to deal with the community, the family of the husband, and all this. So I think counseling and psychotherapy is important. despite the fact that we have only few counselors in the country. But I see that there is an increased number of clinical psychologists and counselors. So having individual counseling or group counseling, or linking yourself to a support group is important to alleviate the stress. Also, things that bring you joy, hobbies that you enjoy, listening to music, going for a walk, exercise, having relaxation like meditation and yoga are important, that will help people deal with the stress. But that again comes at the elite people level. But at the level of our people at the grassroots, we need to design mechanism of supporting these kind of women who are rural, in the rural areas, who are dealing with a lot, dealing with the stigma from people who don't understand IVF, they don't understand difficulties faced by, they don't even have access to counselors. So there must be some support groups that help those kind of women, or linking themselves to these, they call it jamaiya. Women go to jamaiya, they go to where women gather, they have tea, they have coffee. These are things they have to link themselves up, at least to alleviate the suffering and the grief associated with infertility. And setting realistic goals and expectations. You have to come to terms with the situation. If you are not able to get what you want, it's very important to come to accepting and acknowledging one's feelings of grief and disappointment, and setting realistic expectations of the infertility journey that you have been going through, which is not materializing. Seeking medical help is important, because at times when reach a level of depression, it's important to seek medical help. At the level of the society, it is our role as women, as professionals, as healthcare providers, as public health experts, to provide awareness raising to people in our community, like what we are doing now. Media have a big role to play in portraying a positive image of the infertile couples, and telling people that this is normal, and acknowledging that this can happen to anybody, so that people feel at ease with infertility, and feel at ease with fertility treatment like IVF. I'm happy that Udioro mentioned the stigma around IVF. People think that IVF kids are not normal kids. They tend to differentiate between IVF kids and normal kids, and that's not fair at all, because an IVF child is like a normal child. So we have to demystify the stigma around IVF and other fertility treatments and options available to people, to couples who are infertile. Like I said earlier, workplace policies are important. Support groups and community resources are important. And then mental health screening, implementing mental health screening and support services for fertility clinics and healthcare settings. This is in places where they are, but in places like us, I think that could be the role of the gynecologist and obstetrician, to multitask and be a counselor at the same time. Because when you have the couples, I know you've been doing that a lot, and some of your colleagues, but again, it is something that has to be like part of the normal. Nowadays, value-based care is important. uh, Patient-centered approach is important. Looking at your patient and addressing a holistic approach of the problem of the patient, not only the gynecological aspect, but taking a holistic approach. Also, looking into the mental aspect of it is important as the gynecologist obstetrician, because we don't have many mental health care providers in this country. There are only a handful and only a few. So these are a few things I wanted to share in terms of at the individual level and societal level, so that we're able to put in some implementation interventions to tackle the mental health burden of the infertility issues. Thank you.
Thank you, Dr. Victoria. Dr. Idira, do you have any comment on that before we wind up and talk about our conclusions and recommendations?
Yes,
Dr. Idira.
I just like the bit of a holistic approach. So maybe if my fellow gynecologists also go through this video, I think we'll just request, once you have this patient, don't be in a hurry to clear your queue. The person who is important is the one who is inside the room. So take as much time as possible so that you look into the general issues that the patient is facing at home or in the society there before you give the treatment. Yeah, thank you.
Thank you, Dr. Iduro. This has been a very eye-opening discussion. I think also very educational. I'm sure the people who are listening to us at home have gained a lot from this discussion, and many will not say it, but quite a number of people actually needed this to happen, so that they can listen in and think and be able to have information on the causes and some of the interventions, and also for those who are not affected, what they can do to make the burden a bit easier for those who are experiencing this. So we will now conclude this discussion, and we'll start with Dr. Victoria. If you can give us your conclusion and recommendations.
Well, I think infertility is a very important topic, and I thank SSWIF for bringing this topic up. It is something that we need to discuss, and we need to embrace infertility and fertility options. As fellow women, we need to support other fellow women who are going through this difficult time. And women who have issues of infertility need to open up to loved ones, to people they trust, to talk about it. Don't hide it. Don't live with this alone. Don't suffer alone. Share the burden with people you love, people you trust, so that you are able to get over the grief and the disappointment of the infertility. Um, uh, just meet your expectations and live to terms with the situation. Uh, be 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 a good couple and share with your partner your expectations and your challenges, so that you come to terms, both of you, because at the end of the day, it's not the family, it's not the community, it's the two of you who are living together. And it's important to acknowledge that difficulty between you, and that will make you live a better life. From the government perspective, it's very important to have policies and strategies standalone for infertility. So I call upon the Ministry of Health, Directorate of Reproductive Health Services, to really take it up as a priority and come up with policies and strategies to tackle infertility. As we are going through the Revitalized Peace Agreement and going through the law review and the constitutional review, it's important also to put those rights in our laws and to come up with a legal framework for adoption and surrogacy and other things that are related to infertility, because these are restricting people from doing the right thing and from having the legal documents that can help them for adoption and surrogacy. To our colleagues who are dealing with infertility at the clinics, please, if we don't have infertility clinics, do the right thing, refer patients to the right people, and take a patient-centered approach, like I said, a value-based care approach, and do the counseling that is required, because we don't have many counselors out there. To SSWIF, thank you once more for standing for social justice, for bringing up topics that are beneficial to the community and to our people. And please continue doing the right thing. And from our side, as women of South Sudan, we continue to volunteer and contribute our knowledge and expertise to share what we have and raise awareness to our populace. Thank you.
Thank you so much, Dr. Victoria, for that. Dr. Idioro, your conclusion and recommendation.
Yes, my conclusion and recommendation, I think I will still tell our young girls just to avoid that premarital sexual intercourse. I don't want to sound a bit conservative, but it is good to have one partner who will also only have you. So I think with this, because our common factors is tubal factor, let's just try to have protective sex and avoid this unprotective sex, so that we lessen also the risk of infection. And let us seek treatment whenever there is symptoms, because once the symptoms, the treatment is done early, you actually tend to reduce most of the subsequent effects. And also, let's make sure our community embrace the essential childhood vaccines. Like I said, one of the viruses, mumps, which also affect the testicles, although also there is infection of the ovaries, but not yet confirmed whether it contributes to infertility in female. But in men, actually, the infection from mumps affects fertility later in life. So, and at the end of the day, I would say thank you to South Sudan Women Intellectual Forum. You have actually provided us with the space to share our knowledge with our women and South Sudan communities in general. Thank you.
I'd like to give my appreciation to both of you, Dr. Iduro and Dr. Victoria. You've always been willing to come on this panel and share your knowledge and expertise. And we are so privileged and so grateful to have you, and especially as South Sudanese women who are willing to reach out and help our communities all around the world by giving them the information they need on various health related issues. Thank you so much for being on the panel today. We are very grateful, and we know that for those who are listening, they will be able to reach out to you if they have any other questions beyond what we have discussed here. We are so grateful to have such exceptional women leading from the front when it comes to healthcare issues, whether it's reproductive health or health in general. So thank you so much, Dr. Edioro, and thank you so much, Dr. Victoria. It's been a privilege to have you on the panel today. And to our listeners, we are so grateful that you are able to join us. And for those who have not been able to listen to the whole discussion, please find time and listen in, because we have had a lot of pearls of wisdom here. We have been able to be exposed to a lot of knowledge. And the main thing I would say has come out from this discussion is that we have to work on advocacy in terms of reducing the stigma associated with fertility issues, and also give people knowledge on what options are out there. You do not have to suffer in isolation. There are people who can give you this information and this knowledge, and there are medical professionals who are willing to assist you in seeking intervention. So thank you so much. And to our donors, we are grateful. And to those who, to Aisha, who's behind the scenes, thank you so much. And we look forward to having you guys in the next session that we will have. We will be able to put it on the page. Thank you so much. And we are grateful to have had you, the two of you, Dr. Idura and Dr. Victoria, on the panel, and our audience listening in to us. So thank you so much, and goodbye. And have a lovely evening, morning, or day to all of you all around the world. Thank you so much.
Goodbye.
Thank you, Anne.
Goodbye. Bye.